The GameReady is a cryocompression unit. Cold water runs through the sleeves while compression can be applied. The GameReady machine has a pump that inflates the sleeve and deflates the sleeve during the treatment, known as the on and off time. The effects of the GameReady can include the following. It can decrease pain, help with lymphatic flow, prevent further swelling, decrease collagen extensibility, and decrease the metabolism of the injured area. Some advantages of the GameReady is it doesn't get as cold as an ice bag, so it can be used with people who are sensitive to the cold, and it also requires little clinician time. The indications to use the GameReady are post-surgical acute injuries to reduce edema, swelling, and pain. The contraindications for the GameReady are acute stages of inflammatory phlebitis, deep vein thrombosis, arteriosclerosis, compartment syndrome, displaced fractures, local superficial infection, gangrene, dermatitis, vascular ischemic disease, embolism, and vascular impairment. The clinician should use caution if the patient is hypersensitive to cold and check on them constantly. The clinician should also use pain as a guideline during their treatment.
Make sure the cryocompression GameReady unit is the proper modality for the situation. This can be completed by re-evaluating the injury and determining the goals of treatment. If a cryocompression treatment was previously applied, the clinician should review how the patient responded. Lastly, make sure a cryocompression treatment is not contraindicated for the patient in this situation. Next is to prepare the patient both psychologically and physically. The patient should be educated about what sensations they will feel during the treatment. The patient will feel ice-cold water being pumped through the unit, in addition to an intermittent compressive force that will begin distally and gradually move proximally. Explain that the patient may feel some discomfort as the unit provides compression, but the treatments will gradually become less painful as the swelling is pushed out of the injured area. To prepare the patient physically, remove any necessary clothing and place the patient in a comfortable position. Start by filling the cavity of the unit with ice and water, filling the cavity to full capacity. Then plug the power source into a grounded 3-prong wall outlet and plug the power cord into the front of the unit. After the cavity is filled and the lid is closed, apply the sleeve of the unit to the extremity and tighten it. Be sure the sleeve is snug but does not apply pressure to the limb. Next, attach the sleeve tube to the pump and be sure you hear it click. Press the power button on the unit and begin setting up the treatment. Select the desired treatment time by pushing the up and down arrows, select the desired pressure of the treatment by pushing the needle button, and change the temperature of the water flowing through the sleeve by turning the knob towards or away from the snowflakes. For an upper extremity treatment, the desired pressure should be between 40 to 60 millimeters of mercury, which is either the medium or high pressure setting. And for a lower extremity treatment, the desired pressure should be between 60 and 100 millimeters of mercury, which is the high pressure setting on the unit. With the high pressure setting, the unit will inflate for 2 to 3 minutes and deflate for 1 minute. Once the desired treatment parameters are set, including pressure, temperature, and time, push the play button to begin treatment. The length of application should be about 20 minutes and can be applied 2 to 3 times per day until edema is resolved. The GameReady unit also has the ability to use different previously set treatment programs. These different preset programs are often used when a patient is sleeping and have longer on-off times. Programs 1 through 3 provide treatment for 30 minutes and sleep for 30 minutes at no pressure, low pressure, or medium pressure respectively, while programs 4 through 6 provide treatment for 30 minutes and sleep for 60 minutes at no pressure, low pressure, or medium pressure respectively. If the treatment needs to be paused at any time, be sure to push the pause button before removing the sleeve. When the patient is ready to restart treatment, reapply the sleeve and push play. Any adjustments made to the treatment parameters also require the patient to press the pause button.
After the treatment is done, the patient should schedule their next appointment. The treatment should be recorded and how the patient responded to the treatment as well. The GameReady machine should be cleaned by emptying the water and ice out. After this, the GameReady machine is ready for the next treatment.